They're hiding behind blooming algae as they twist arms and try to work their backroom deals. But, Madam Speaker, your leadership cannot hide forever. If the Democratic majority proceeds with its plan to ram through their health care bill without actually holding a vote, it's going to take more than algae to protect them from the American public's outrage. And with that, I reserve the balance of my time.
The gentleman reserves. The gentlewoman from Maine is recognized.
Thank you, Madam Speaker. I had no idea that we were here to debate health care this morning, but I appreciate the gentleman, my friend from California, bringing up the differences between us.
Will the gentlewoman yield?
Not yet. I'd like to make a couple of points, and the gentleman has plenty of time of his own.
Well, I still look forward to yield her. I was happy to yield under my time, and I hope she'll do the same.
I appreciate that. But let me make a couple of points. First off, we are here today to take up this bill that could have been done under suspension, but as I understand, my colleague voted no when this bill originally came to the floor, which is why we're back here again today to pass what is a relatively simple, I agree, piece of legislation, but very important in coastal districts like mine. And yes, we do have a disagreement on health care legislation, and I wish that your caucus was doing what my caucus is doing right now, and that is going through the health care legislation that we hope to bring to this floor soon, line by line, to make sure that we are confident that this is excellent legislation to move forward the cause of health care reform, something which he and I don't agree on. I support very strongly, and I am looking forward to the debate that we will have on this floor about that health care legislation, and I am thrilled with the year and a half that I have spent here and the number of hours that committees and members on both sides of the aisle, Republicans and Democrats, have put in crafting health care legislation. Now, we may not agree on the final product, and that will come down to a vote. And you're right, it will depend on making sure that we have enough votes on our side of the aisle, and I am glad that we are making sure that everyone feels confident about that vote. But, you know, it was interesting. I, as you know, I'm a freshman, so I wasn't here in previous years where you were. But when you talk about arm twisting and getting votes, I am reminded of the stories that I have heard about passing the prescription drug legislation and what it took for the other party in the middle of the night, with a vote open for many hours, to pass a piece of legislation that I have to say, from my perch as a former state legislator, from a state where the cost of prescription drugs is crippling a health care cost for many of our senior citizens, I was shocked to see what that final piece of legislation came to be, and I am thrilled that our health care legislation that I believe will be on this floor soon will fix some of the problems in there. I'm sorry to say not all, but I remember hearing about that legislation. Was it 2 hours? Was it 3 hours in the middle of the night where people were convinced to change their votes to get their vote, where every minute counted to get one more vote? And that was the legislation that left us with this tremendous donut hole, which our senior citizens talk to me about every day. Frankly, that's the public opinion polling that I hear about when I go back to my district. Will the gentlewoman yield? I will not yield. I want to tell you my story of what I hear in my district. It's not a public opinion poll. It's senior citizens who come up to me and say, do you see what it costs me to buy my prescription drugs? Do you see what happens when I get into the donut hole? And here's what they really asked me. They said, how could the Republican Party pass, in the middle of the night, twisting arms for every vote, how did they pass a piece of legislation that didn't allow us to negotiate with the pharmaceutical manufacturers for the price of prescription drugs? I can tell you, in my home state of Maine, this was an issue for years. When I first got elected in 1992 to my state legislature, senior citizens came up to me and said, do you see what it cost me to buy my prescription drugs? And then every year it got worse and worse and worse as the pharmaceutical manufacturers, some of the wealthiest corporations, multinational corporations in this country, were able to sell their drugs at the highest prices in the world to senior citizens in America, those people who had to pay cash for their prescription drugs, those people who had to decide whether they put heating oil in their tank to keep warm, whether they put food on their table. But when the Republicans came to the point where they could have changed the law, like they do in Canada, like they do in virtually every other country in the world, where they could have done what they're always telling us, be like a good business practices. You know, I own a small business. I wouldn't think of buying something that I didn't negotiate for. Well, that's what that bill said. It said we don't negotiate. In fact, we will give them the sweetheart deal. We will say to our senior citizens, you know what, we're going to pay the highest prices in the world, so there will be no cost savings. These are the same Republicans who tell us now that there isn't enough cost saving in our health care bill. They use it as an excuse. But that was what was done in the dark of the night, 3 hours holding up in a debate to say to us, you know how I first found out about this? I got on a bus with senior citizens from the state of Maine. Let me tell you how it works. We stop in Biddeford, Maine, and then we go to Portland, Maine, and then we go to Lewiston, Maine. We stop at places all along the state of Maine, and we drive all the way up to the Canadian border. No, I will not yield. We get all the way to the Canadian border.
I didn't ask you to yield.
But you had that look. We get to the Canadian border, and we visit with a dually licensed physician so that they can rewrite their prescription, take it across the Canadian border legally. So then we go to a Canadian drugstore. This is a busload of senior citizens. We go into that Canadian drugstore, and they buy their prescriptions. And I want to tell you about one person I sat next to on one of the many best trips. I sat next to a person who had to take tamoxifen, a wonderful drug that we are glad we have for breast cancer, but they take 30 pills a month. At that point, I think it cost them about $150 a month for their 30 pills. But when we got across to the Canadian border, it was $12.35. That was highway robbery, in my opinion. You know why that was? Because the Canadian government, just like every other Western nation, requires that they negotiate for the best price possible.
Gentlewoman yield, Madam Speaker.
Not quite. I'm almost done, though. They negotiate for the best price possible. So as far as I'm concerned, that's what should have been in that prescription drug plan that was decided in the middle of the night when arms were twisted to get every last vote. That's what should be closing the donut hole, lowering prescription drug prices in the health care bill that we will debate soon. As far as I'm concerned, I am thrilled that members of my caucus are here today to go through line by line to make sure that we're getting the best possible health care plan we can get. And I will say, it's not going to be everything I want in a health care plan. I come from the state of Maine. They think single payer. Our doctors think that single payer ought to be the health care plan in Maine, and I'm right there with them. But I know that's not what we're going to get here to vote on the floor. But I'm anxious to make sure that we get the best possible compromise, and I would be thrilled if some of the members of your caucus would vote for that bill.
Madam Speaker, will the gentlewoman yield?